Sierra Leone sees sharp rise in Mpox cases with 14 people dead so far this year. This is Africa Live. Hello and thank you for joining us. I am Penina Karibe. We'll begin in Sierra Leone, where health authorities are calling for extreme care among the population as an outbreak of Mpox intensifies. The West African country has reported more than 3,000 cases since the start of the year, along with 14 deaths linked to the disease. The World Health Organization declared an outbreak of Mpox a public health emergency of international concern last August. And while this has largely worked to prevent a global spread, local outbreaks are still common in Africa. CGTN's Eric Kawa has more from Freetown.
This is just one of the over 1,600 Sierra Leoneans who have recovered from Mpox. For purposes of this report, we'll call him Alex. He got infected while on duty, but he sought treatment immediately. After 2 weeks under medical care, Alex is now fully recovered from the disease.
And
It wasn't easy. It wasn't easy because I have seen different videos of how Mpox attacks and targets people. So I was down mentally and physically too. I wasn't okay because I recalled that I have a wife at home, though she can abstain. But I also have a young child who is 10 months old.
But I get a young pekin of the age of 10 months.
Mpox presents symptoms like fever, body aches and a rash. Alex is encouraging Sierra Leoneans to seek medical assistance as soon as they develop signs of infection.
Call on everybody to adhere to the precautionary measures.
I call on everyone to adhere to the precautionary measures the government has put in place because Mpox is real. Yes, for now, we notice that the death rates are low and people have the perception that Mpox doesn't kill, meaning it isn't bad. But after having gone through the virus, I know what I went through.
Health officials say the lessons learned from a serious Ebola outbreak in Sierra Leone and COVID-19 pandemic have helped them tackle the current Mpox outbreak more effectively and establish isolation centers in all districts across the country. The government is now focusing on vaccinating those facing a high risk of getting infected.
8.5 million people in this country, and we have 58,300 doses. So definitely, we have to prioritize. 1. Health workers who are in the front line, contacts of infected persons, because if somebody is infected now, all those around that person are high-risk contacts. So we encourage those to be vaccinated and those that have other underlying ailments, like people that are immune to compromise. So these are actually the priority groups. So if we get more vaccines, we might even review those criteria.
People across Sierra Leone have been urged to avoid close contact with infected persons, practice good hygiene, and follow safety guidelines to prevent further spread of the disease. As Sierra Leone continues the battle in the Mpox virus in a series of public health challenges, communities, caregivers and the government are racing to respond, drawing on lessons learned from the past and hope for the future. Eric Kawa reporting for CGTN in Freetown, Sierra Leone.
Other countries across Africa also continue to report Mpox cases. Ethiopia recorded its first case this Sunday. A 21-day-old infant has tested positive in Moyale town near the Kenyan border. Subsequent testing confirmed the child's mother is also infected and both of them have been placed in quarantine. The Democratic Republic of Congo remains the epicenter of the outbreak, with both the clade A1 and 1B strains circulating in the country. Over 7,000 confirmed cases and 22 deaths have been recorded in the country since January. Uganda also continues to observe a larger outbreak, reporting about 200 new confirmed cases per week. So far, over 4,000 cases and 28 deaths have been reported this year. Burundi, meanwhile, shows signs of declining cases. It is reporting less than 50 new confirmed cases per week, down from over 200 at the peak of the outbreak there. While 5 African countries have reported cases so far this year, the outbreak, which began last year, has hit 25 countries on the continent.